Hello. Today we're going to be doing a eye, ear, nose, throat, skin, hair, and nail assessment. My name is Jeremy Carroll. I'm a registered nurse, and this video is for Ohio Christian University course NR 3400, which is assessment and genetics. This is my patient with consent, Tiffany Carroll, and I would let you know that first I have washed my hands before this procedure is started, and we're ready to begin our assessment. Starting with skin. I'm going to have my patient expose arms and her lower legs. Typically, you would observe the entire process of the skin. You're looking for color, pigmentation, whether hyper or hypopigmentation, noting any abnormal color changes. The next thing you would want to do is check temperature. You're going to check the temperature using the back sides of your hands, checking different areas of the skin, looking for symmetry amongst those, also looking for skin turgor. The skin should snap back, which is a good sign of hydration, as well as the temperature that you're feeling, looking for any excess moisture or dryness, thickness, any swollen areas, bruised areas, vascularities, and you would also want to make sure that you observe the back side of the patient as well. Next, moving on to the face, I would have you look at me, please, and I'm looking for symmetry of the face, as well as we'll check the temporal pulses. There's good pulses there that are equal. And then I would apply pressure to the frontal and the maxillary sinuses. Do you feel any pain or pressure there? Good. Making sure that if there was pain with pressure, there could be infection or an infective process along the way. This is a good point with your observation that if the client or patient does not have good hygiene, which this patient does, but if they would, it would be the time to do some teaching for appropriateness of hygiene and process. The next thing that we're going to go to is to continue on down the body. You would look to front and the back. You would be observing for lesions, macules, papules, or any other texture, moisture, temperature differences from one side to the other, as well as especially swelling around the ankles and lower legs and redness. That could be a sign of cellulitis. One of the things that you can teach your patient is the ABCDE process for self-evaluation of their skin, especially if they discover a mole or a lesion or any other kind of abnormality to their skin. The A stands for asymmetry of the mole or lesion. B is for the border, whether it's irregular or regular in shape. C is for color. And you definitely, if they notice one, they should be observing it at least monthly for color changes, as well as diameter. The D is for diameter, and E is for elevation or enlargement, especially if a spot starts to elevate. That can definitely be a sign for alarm and for a need to follow up with their practitioner. We'll move on to the hair. First, I would observe the texture and the color and the distribution, looking for any areas of alopecia, as well as lesions or bumps. I'm going to go ahead and palpate the scalp. You don't feel or see any lesions. Of course, if you found a lesion, you would want to don your personal protective equipment or gloves at this point. I'm going to feel the skull for uniformity. I'll also feel the occiput for symmetry and midline, and also look for any infestations as far as lice or other items that could be in the hair from that point on. The next thing that we would do is to look at the nails. I would want to look at both sides, hands and feet, typically. We're looking for uniformity amongst them, also looking for their color. It should be pink, not dusky. I would check capillary refill of several. I should see a capillary refill. That's a sign of good circulation of less than 3 seconds. And then also I would look for ridges and check textures of nails, making sure there's symmetry. And then also have you put your thumbs together like this. Perfect. No signs of clubbing. You can observe that with an angle greater than 160 degrees with that. Moving on, we would check the eyes. First, I'd have the patient look at me, and I'm looking at the sclera. They should be white. If there's excess redness or a yellow of jaundice or any colors like that, you would want to definitely report that. The next thing I'm going to do is pull down on the eyelids gently, and I'm looking for pink. Interior aspect of the eyelids shouldn't be pale or dusky or appear dry. The next step we're going to do is we're going to get our light source here, and I would have the patient look at me, and I'm going to shine a light directly into the eyes, and I'm looking for a pupil reaction where the pupils are round and equal and reactive to light. Following that, we would do a peripheral vision check. So I'm going to have you look in my direction here, and I want you to tell me when you see my fingers. Good. Now when you see my fingers, you got to keep looking at me. Good. Now when you see my fingers. Good. So the peripheral vision is good. Then we would follow with the 6 cardinal views. I'm going to have you put your right hand over your right eye and follow my finger. We'll go out, up, down, and back in. And go ahead and cover your left eye now and expose your right eye. Same thing, follow my finger, out, up, down, and in. Perfect. At this point, we would start our fundoscopic evaluation using our ophthalmoscope. When you're utilizing the ophthalmoscope, you want to make sure that you use the same hand as we are the eye. So if I'm starting here with the left eye, I would hold the ophthalmoscope in my left hand, and I would be utilizing my left eye. I'm going to take my other hand and place it on the patient's forehead, putting my thumb near the eyebrow so I can know where the eye is to make sure there's no unintentional bumping into the eye, because this is a close examination. I also like to use my pinky finger to kind of be a guide for the distance I need to be. I'm turning my ophthalmoscope on. I start back far enough where I can see the reflection, and then I slowly move in on the patient until I hit 1 to 2 inches. Using the diopter to change the focus for clarity within the retina, I should be able to see the sorry, I lost my place. I should be able to see the macule, the optic disc, the vessels, and the retina. That evaluation will be completed on both sides. The next thing that we will be looking for is with the ears. I'm going to look at the external aspects, looking for symmetry. There are piercings. And then I would definitely want to palpate for masses, the areas, and then do the tug test where I'm pulling back on each. Do you feel any pain when I do that? This is a test you always want to perform before using an otoscope inside the ear, because if the client experiences pain with the tug test, then you should defer the otoscopic evaluation to the physician for that. At this point, we're going to take our otoscope. We're going to get our light source on here. I'm going to hold it in a pencil grip, using, again, my pinky as kind of my rudder for the face. Using my other hand, and again, it's left hand to left ear. It would be right hand to right ear. I use my other hand to grab a hold of the pinna and pull up and back. And then I start observing at the outer surface, and then slowly placing the otoscope into the ear, observing the ear canal until I find, and moving until I find the tympanic membrane. I should be able to observe with the tympanic membrane the handle of the malleus, light reflex, the pars tensa, and the pars flaccida. If there is wax or other obstruction, those are, again, things to report, because there might be issues with infection or overproduction of wax at that point. Another item that frequently is used during this time frame would be a tuning fork as well. We'll swap those out real quick. The next thing we're going to do is observe the nose. First, I'm going to look at the external aspect of it, looking for deformities, asymmetry, any changes in the color of the skin or in lesions. The next thing I would be doing is to use my non-dominant hand, and again, I'm going to turn on my light source. I changed my my otoscope out here, and I'm going to place my thumb and have the patient lean their head back for me. Good. Pull up gently, starting externally, and we're going to enter into the edge of the nose, viewing the mucosa, the turbinates, also checking the septum for deviation and or drainage or infective looking process or abnormal drainage for that part. And we're going to go ahead and move that one. The next thing we'll be looking at is the throat and mouth. First I would observe externally the lips for cracks or any asymmetry in the facial expression. I'm going to have you smile at me. Perfect. There's good symmetry. Next I'll have you open and say ah. And observing around, say ah again. Ah, tongue out. Ah, ah. There you go. Good. When checking the mouth, we're looking for the tonsils, the uvula, the hard and soft palate, dentation, pillars, and the mucosa, checking for indurations and or masses. This concludes our evaluation and examination of the eyes, ears, nose, throat, hair, skin, and nails. I hope that you have a great day.